Why do peptic ulcers keep coming back? Imagine having a sore on your stomach lining that just won't heal completely. That's what happens with peptic ulcers, and they often keep returning even after treatment. The main reasons are related to ongoing exposure to their causes. The two biggest culprits are infection with a bacteria called Helicobacter pylori and the use of certain medications known as non-steroidal anti-inflammatory drugs, or NSAIDs. If these factors aren't fully addressed, ulcers are likely to come back. Peptic ulcers are open sores that develop on the inside of the stomach or the upper part of the small intestine, called the duodenum. They from when the stomach's natural defenses, like mucus and bicarbonate, are overwhelmed by aggressive factors such as stomach acid and pepsin. Usually, the body can keep this balance, but when it's disrupted, ulcers form. When the infection with H. pylori persists or the use of NSAIDs continues, this balance remains broken, leading to repeated ulcer formation. One key reason ulcers keep returning is incomplete eradication of H. pylori. If the bacteria are not fully eliminated with antibiotics, they continue to irritate the stomach lining, causing ulcers to reappear. Studies show that when H. pylori is successfully treated, the chance of ulcers coming back within 3 years drops below 10%. But if the bacteria are not fully cleared, recurrence rates can be higher than 50%. Another major factor is ongoing use of NSAIDs. These drugs block prostaglandins, which are substances that help protect the stomach lining. When prostaglandin production is reduced, the stomach becomes more vulnerable to acid damage. People who keep taking NSAIDs after an ulcer have a much higher chance of it returning. This is especially true for older adults, those with a history of ulcers or gastrointestinal bleeding, and individuals taking steroids or blood thinners. Smoking also plays a role. It impairs the healing process of ulcers and reduces blood flow to the stomach lining, making it easier for ulcers to come back. Other factors like stress, certain chronic illnesses such as kidney disease, and conditions that cause excessive acid production, like Zollinger-Ellison syndrome, can also contribute to recurrence. Even host factors like age and overall health matter. Older adults and those with other health issues tend to have higher rates of ulcer recurrence, regardless of infection status. To help prevent ulcers from returning, doctors often recommend medications that lower stomach acid, such as proton pump inhibitors or histamine 2 receptor blockers. These reduce acid levels, giving the stomach lining a better chance to heal and stay healthy. In conclusion, peptic ulcers tend to come back mainly because of persistent infection with H. pylori, continued use of NSAIDs, and lifestyle factors like smoking. Effective treatment involves fully eradicating the bacteria, stopping or reducing NSAID use when possible, quitting smoking, and using acid-suppressing medications if needed. Regular follow-up with a healthcare professional is essential to monitor healing and prevent future episodes. Remember, each person's situation is unique, so personalized medical advice is always the best way to manage and reduce the risk of recurrent ulcers.